Alright, the skull trigger, I'm Jonathan, and the skull trigger of mine is about to begin. I should preface a couple of things here. One is that I did not use a cone filter in this trigger because I couldn't find one that fit the tube that I was using. And we looked all around the department and, and asked a couple of the techs. And after much searching, we found the cones kind of off in the corner gathering dust, and none of them was appropriate for the trigger. So we didn't use a trigger, but ideally for sinuses, mandible, and for zygomatic arches, I would have used a cone to make sure that I'm not over-radiating the patient and exposing more tissue and bone than necessary to get the diagnostic images I'm looking for. The other item in here is that I began to use my markers toward the end of my trigger and not at the beginning. So that's a problem because obviously without the markers there's no telling necessarily who took the picture and which side it is of. So I kind of got with the program there towards the end, but I was focusing too much on everything else and kind of let that fall by the wayside. So anyhow, there's all that, and without further ado, here is the I think I might have said skull trigger. It's the skull trigger. I might have said chest earlier. Skull trigger. That's what we're shooting. Here I have a rec for a patient who needs to have x-rays taken of sinuses, mandible, and zygomatic arches. So it might be an interesting situation here that we have all of those x-rays that need to be done on the same patient. What I'm going to do first is I'm going to clean off the bucky and sanitize it here with some cavi wipes because the patient's head is going to be touching the board quite a bit. Oh, I should probably do that while the patient's watching. So I'll wait on that. And I'm going to go ahead and go get my patient. So I'm going to kind of follow me with it. Jose?
Yep.
Alright, come on in. My name's Jonathan. I'll be taking your pictures today. What's your last name, Jose?
Leon.
Okay. And what's your birthday?
It's October 18, 1986.
Okay. Alright. Are you pregnant? Any chance you may be?
No.
Okay. What brings you in today?
I was in summer camp for cheerleading. We're doing some routine, something we practice a lot. I'm the flyer, so they threw me up in the air. They didn't catch me. I landed on my right, the right side of my face, hit my mandible, my part right here. And then to top that off, I came up with a sinus infection. So
you got it all going on
Yeah.
today. All right. So tell me again, just real quick, where does it hurt the most on your face?
So mandible area right here,
Okay.
and then around here,
Okay. All right.
and then my sinus. I have sinus pressure here.
Okay. All right. Okay. Well, what I'm going to do here is I'm going to clean off this because your head will be touching it a couple of times. So we'll just make sure that that's nice and clean. So, there we go. And I got a couple of things I'm going to have you put on, and then I'll have you take a seat. So, this is for you to wear to cover your front side. Also, could I have you remove your necklace once you get that on? Perfect. Alright. And you can just cross those straps in the back and then bring them around to the front. Excellent. And I'll have you put this around your neck as well. Alright. Very good. And come on over here. And have you take a seat just like this. Alright. So, Jose was saying that the right side of his face is what's hurting, so that's the affected side. That's the side that we're going to put closest to the bucky. So, I'm going to bring the bucky up a little bit here. Alright. And line my tube up with my bucky. And also I'm going to put a cassette in there. For all of the pictures that I'm taking today, I'm going to use an 8x10 cassette. And I'm going to load this in horizontally. That slips down a little bit. I would want to make sure, of course, that it's exactly on par with my crosshairs in my V. So, Jose, can I have you scoot the chair any amount closer? Good, good, okay, all right. Yeah, that's good. Kind of make it diagonal with your body and then look directly this way. Okay, there we go. So since we're looking at the sinuses in this lateral picture, I want the central ray to be about 1 inch to 1/2 inch behind the outer canthus of the eye. So I'm going to need to bring my tube up a little bit and bring up my bucky as well. Alright, and I only need the sinuses, I don't need the whole cranium, so I can collimate down here, include the nose in there, but I don't need the top of his head or the back of the skull, so I'm just going to be going that way. I have the IOML perpendicular to the, well, parallel to the floor I should say, and then also the mid-sagittal plane is parallel to the IR. So, everything is looking good there, and actually, since I have him kind of with his back turned, I'll probably just add this extra shield here. There we go, you can kind of support that there. Alright, thank you, Jose. Hold very still, I'm going to turn you a little bit more this way. Good, right there. Hold very still. Alright, Jose, hold your breath. Bing! Alright, the technique that I have set for that one is 75 at 6, about. I don't want to use a lot of technique because I don't want to blow out the sinuses. I can use a fairly low technique for the sinuses. So my next picture, I would change out my cassette, put a new 8x10 in there. Jose, can I have you turn your back towards me? The back towards the camera, your face will be towards the board there. Good. I'll go ahead and put this behind you. So we'll just cover your backside there. There we go. Now these aprons are heavy. I feel okay with having him wear both of them because he's sitting down. If he were standing up, I would probably just have him wear one and change that. So the next thing we're going to do is the Caldwell. And the Caldwell, I'm going to have my OML tilted up 15 degrees. So I don't want to tilt the tube on this one because I want to see the air fluid levels in the sinuses, and I'm going to see that better if the tube is horizontal. So I'm looking at my OML here, and that's about 15 degrees up. That's where I want it to be. My CR, of course, is perpendicular. The mid-sagittal plane also perpendicular to the IR. And what I want to have my central ray do is to exit the nasion. So that actually is looking pretty good there. It's coming right here, coming all the way across, going through the INL there. Actually, can I have you tilt up just a tiny bit more, Jose? Good. And I don't think I'll need to bring that up a tiny bit. To make sure that the central ray exits the nasion. There we go. You're doing great. Hold that right there. Hold your breath, Jose. Beep. Alright, the technique that I've used for this one, 75 at 8. Alright, so my next picture, the Waters picture. I'm going to want to have my OML 37 degrees with the IR, so we're making an angle like that. So Jose, I'm going to have you tilt your head up. Another way that I can think about this angle is to have the MML perpendicular to the IR. Mid-sagittal plane also perpendicular to the IR. My central ray exits the acanthion, so I'm looking right below the nose. That's where I want it to come out. So for this one, I'm going to move it down just a tiny bit. There we go. And of course, I need to adjust my bucky as well. I need to change my cassette, put another 8x10 in there. And I think I'm ready to go here. Looking good, Jose. We're still shielding on the back side. So I'm going to come over here, set my technique to 75 at 8. Jose, hold your breath. Beep. And relax. All right. So I take out my 8x10. I put a new 8x10 in there. And I'm ready to set up for my SMV. So, Jose, go ahead and scoot back the chair. Good, good, good. I'm going to have you stand up, and I'm going to pull the chair back a little bit. All right, come towards me. I'm going to turn the chair around. And if you would like, you can remove that shield on the back. There we go. And go ahead and have a seat one more time. All right, and you can scoot the chair forward a little bit. Good. And just go ahead and slouch down. Good. Now what I'm going to have you do is look straight up to the ceiling. So good, good. Yeah, perfect. Right there. Okay.
don't want Jose to have to hold this position very long because it's not very comfortable. My central ray needs to enter the mid-sagittal plane, and it needs to be 3/4 of an inch anterior to the EAM. So I look at the EAM, I come up about 3/4 of an inch. There we go. I'm going to make sure my bucky is lined up. For this picture also, I want the IOML to be parallel to the IR. So I'm looking at this line here. Jose, can you bring your head back to my hand and aim out more? Good, right there, perfect. All right, that's looking pretty good to me. Pardon me, I'm going to set my technique at 70 at 6. All right, beep. Jose, go ahead and relax. You can bring your head up. There we go. All right, I'm going to change out my cassette. We've got all of our sinus pictures now. So, you can go ahead and scoot the chair back to the bucky. There we are. Now we need to take the pictures of the mandible. So, what we're going to do now is we're going to actually turn the chair all the way around and you're facing the bucky one more time. Alright, thank you, Jose. You're doing great. Alright, for this one I want to have the nose and the forehead touching the IR. So you're going to be looking down just a little bit, Jose. Good, a little bit, tiny bit more. Just like that. Good. Alright. My CR is perpendicular for this one. It's going to exit the acanthion. I'm going to put it down. About there. Alright, I'm going to need to remove the thyroid shield for this one here. Just because I want to not block anything. Jose, I'm going to move you a little bit to your right. Good, right there. So I see my crosshairs there. So CR is perpendicular. It's exiting the acanthion. The forehead and the nose are touching the IR. For this one, I'm looking at the ramus. So I'm looking at the rami, the two flat portions of the mandible. So I'm shooting through the C-spine, of course, to get to the mandible, which means I'm going to need a little bit of a higher technique. So my technique for this one's going to be 75 at 12. That looks pretty good to me. I'm going to take my shield one more time and cover Jose's backside here. There we go. Kind of support that there. Thank you so much, Jose. Good. Okay, right there. Hold very still. You're doing great. Hold your breath, Jose. Beep. All right. There we go. So, next picture. Axiolateral oblique ramus. So the mid-sagittal plane, one more time, is going to be parallel to the IR. So, Jose, I'm going to have you turn your chair once again. Jose, thankfully, is a young patient and is able-bodied enough to just move all of these things around. I might need to take other measures if he were an older patient, but since he's able to do this, this is what we're sticking with. So for this one, I'm going to need a 25-degree cephalic angle on my tube. So I'm going to move it down a bit, angulate it up to 25 degrees cephalic. So that means I'm going to need to lift my bucky. I want my CR to enter halfway between the gonions. So between these 2 points on the mandible. So Jose, go ahead and sit forward here. Good. All right. I'm going to move my bucky up to meet that place. Of course, I need to put in a brand new 8x10 cassette for this one. My IOML is going to be horizontal. So there we go. Kind of a, yeah, slant with the body there and then look directly to the side. Good. Okay. So I'm looking at my IOML and I want that to be lined up with the top of the bucky. And I'm going to need to change where my entrance point is because I want it to be between the gonions there. So I'm going to need to move that down a little bit. And Jose, can I have you lean back just a little bit? Good. And just a little bit more. All right. Let's take the shoulders a little more this way and look towards me. Good. And again, I have his affected side towards the IR. And have you lean back a tiny bit more. Good. There we go. Right there. Alright. So I'm going to need to move the bucky one more time to make sure it's all lined up. Alright. A little bit more rotation in the shoulder is good. So I want to get the shoulder out of the way so that it doesn't appear in the picture. Jose's doing a great job of moving the head. There we go. You might even tilt the chair a little this way. Good. Okay. And a little bit more Yeah, perfect, right there. All right. My technique for this one, 75 at 8. I don't want it to be super high because I'm really only getting this part of the mandible in the picture. So you're doing great, Jose. Hold right there. Hold your breath. Beep. All right. The next picture, I change out my cassettes. I put another 8x10 in there. I'm going to do the axiolateral picture of the mandible. This time I want to look at the body. So I'm just going to rotate Jose 30 degrees toward the affected side. I'm going to use the same technique, the same central ray entrance point, the same 25 degrees cephalic angle. So just turn your head a little toward, yeah, perfect, right there, maybe a little bit less. Right there. Good, okay? And scoot back just a tiny bit. Good, so I've got my crosshairs right there between the gonions. Good, Jose, all right. Hold your breath. Beep. All right. We're going to do one more picture with this exact same X-ray beam. I change out my cassettes, I get a new one in there. The only different thing about this one is that we're going to be looking for the symphysis, so this middle point in the mandible here. So that means I'm going to turn Jose about 45 degrees toward the board. Good. Excellent. So we're shooting up between the gonions and we're getting that symphysis of the mandible. Everything else is the same. Same technique. I'm going to put this on you one more time, okay? You're doing great. There we go. We can kind of pinch that there. All right. All right. Shoulder toward the board a little bit more. Good. Good, good, good. All right. So here we go. Still 75 at 8. Beep. All right. Relax, Jose. You're doing great. Excellent. So there we go. We've got our sinus pictures now. We've got our mandible pictures. We got 4 for each. Now we need to get our pictures for the zygomatic arches. So, Jose, we're going to do that kind of weird one more time where you're facing the camera and you're looking up at the ceiling. So good. So we turn the chair all the way around toward the camera. Very nice. Once again, my central ray needs to be horizontal. So I need to change that. I'm going to blind Jose, so I'm going to kind of do this here. Alright. And Jose, one more time, scoot the chair a little bit more towards me. Good. Slouch forward in the chair. Excellent. Okay. So the only thing that's different about this SMV, go ahead and bring your head up for a second, Jose, and scoot the chair a little bit to your right. Good. Alright. Go back a little bit towards me. There we go, right there. Excellent. So the only thing that's different about this SMV is the technique and the central ray entrance point. So, central ray is perpendicular, MSP, also perpendicular. IOML is parallel to the IR. So we want this line right here. I'm going to have you tilt back just a tiny bit more. Doing great. Okay, I'm going to move this bucky down. Alright, there we go. Central ray down. And there we are, lined up, central ray and bucky. This time the central ray is entering 1 inch posterior to the outer canthus. So I see the outer canthus right here. I want to come just an inch down behind that. I'm going to use a technique of 60 at 6 because I don't want to blast out these small bones here, the zygomatic arches. So Jose's doing great right there. Hold your breath, Jose. Beep. All right. And go ahead and bring your head up. Thank you. I know that's a difficult position to hold. All right. We need to take 2 more pictures for the zygomatic arch. Because it's Jose's right side that's bothering him, that's the side that we need to feature in this picture. Alright, so the next projection that we're going to do is the tangential projection. So we're going to take a look at Jose's cheekbone from underneath. So we're going to have a horizontal central ray for this one. Alright. And make sure that we're centered to the bucky there. So, there we go. Alright. So Jose, I'm going to have you take that shape one more time, but before you do, I'm going to move you over this way a tiny bit. Okay, there we go. Alright. So go ahead and slouch down in the chair and then lean back and look directly up at the ceiling. Good. So we're setting up exactly like the the SMV, but we're going to have to add a double angle to this projection here. So the IOML once again is parallel to the IR. So I'm going to have you tilt back just a little bit more. Good. So the IOML we want to be parallel, so just a little bit more. You can slouch down in the chair a little more. Good, good, good. There we go. All right. So I may come down a little bit here to help facilitate that. Good. And I'm going to bring my bucket down to match my tube. There we go. Alright, now we're looking at the right side. So I'm going to need to angle Jose to make sure that the right cheekbone is the one that's featured. So I'm going to need to have him turn his nose 15 degrees toward me, good, then turn the top of his head 15 degrees also, actually away from me. So good, go ahead and bring your nose toward me, then the top of your head that away. Good, 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 good. Okay, so I'm marking the right side there. I'm going to have you tilt back just a little bit more. You're doing great. Okay, good. A little bit more towards me, and the top of your head a little bit more away. Good. So what I want to see is this shadow right here, the shadow of the zygomatic arch. This is what we're shooting for. This is what we want to see. The central ray is going to enter 1 inch posterior to the acanthion. So I can actually bring that up a tiny bit there. Alright. And actually my tube still looks pretty good. So I've got my right side marked, my double angle, and I'm going to shoot this at about 60 at 6. Beep! Alright, Jose, you can go ahead and bring your head up. There we go. Thank you. I know that's an uncomfortable position there. We shoot that one with a pretty light technique because it's a fine bone and we don't want to burn it out. So there's nothing else that we need to see in there. We just need to see that one bone. So we got that. Stop that. The very last one that we're going to do is the modified town. It's modified from the regular town only in one way, and that is the entrance point of the central ray. So I'm going to have his OML perpendicular to the board. So bring your chin down a little bit, Jose. Good. A little bit more. Tiny bit more. Good. Right there. Okay. And my central ray is going to enter right at the glabella. Probably not quite at 30 degrees. Alright, so I'm going to need to line up my bucky now to make sure everything is kosher here. I'm going to mark anatomically here. So I've got my left marker on the left side. And I'm going to collimate down. Alright. Right marker on the right side, pardon me. Here we go. So I have my central ray entering at the glabella, 30 degrees caught at, OML perpendicular to the IR, mid-sagittal plane also perpendicular to the IR. I'm going to use a technique of about 70 at 16 for this one. So a little bit higher technique because we're getting through more bone here. So, a little bit further down with the chin, Jose. A little bit more, a little bit more. Right there, good. Alright. Jose, hold your breath. Beep. Alright, so I come out, I take out my cassette, I look at all of my cassettes. You can go ahead and open your eyes, Jose. I'll take the light out of your face there. And make sure that I have all the anatomy that I need in all the pictures, and if I see everything that I need to see, then I can let Jose go. And of course, regrettably, I didn't use my markers in all of my images, so I would need to annotate that, unfortunately, for the pictures that I missed. In any case, we are ready to go, so you can go ahead and stand up and remove the lead apron there.
I'm starting to like this.
Yeah, it's pretty stylish, isn't it? Maybe you can wear it in your next routine. Alright, and then here's your necklace, Jose. There you are. Do you have everything else that you came in with?
Yes, I do.
Okay, alright. So, you know how to get out of here?
Yes, I do.
Okay, alright. Thank you, Jose. Thank you. Alright, Jose was a great sport, and we're done with that. Thank you.
Here we have the sinus lateral picture. Lateral sinuses. What we want to see in this picture is all 4 sinuses. So we want to see the frontal, the maxillary, there's the maxillary actually, the ethmoidal, and then the sphenoidal sinuses. We want to see all 4. In this particular picture, the sinus of interest that we really want to see well is the sphenoidal sinus here. just below the sella turcica. It's important that there be no rotation in this picture, so we can judge that by looking at the orbital roofs. They should be clearly superimposed, and also the mandibular rami should be superimposed as well. So no rotation. We want to see air fluid levels. If there are fluid levels in the sinuses, it's very important also that the IPL, the line coming out at us this way toward us, is perpendicular with the IR and is just parallel to the ground, so that we're going to be able to see what's going on in there. The collimation for this one is also important. A cone can be used for this one. Again, I didn't have a cone for my trigger available, so I just collimated down. It looks like they collimated down pretty well here. There is a little bit more anatomy maybe than needs to be shown in this picture. But the sinuses are all that we need to see, so we don't need to see much else. A cone could have been used for this picture. Next we move on to the Caldwell, which is the PA axial, although in this case it's just the PA, parieto-acanthial projection. Again, we want to have no rotation in this picture, so a way that we can judge that is by looking to see that we have equal distance between the lateral border of the skull and the lateral orbit border. So this should be the same distance here as this is here. So no rotation, that's very important. And the petrous ridges should be in the lower third of the orbits, and more or less they are. There's the petrous ridges there in the lower third of the orbit of the eye, and symmetrical on both sides. So I think we're looking pretty good here. Everything looks pretty symmetrical by and large all the way down. Particularly we want to see the frontal sinuses in this picture above the frontal nasal suture. So up here, frontal sinuses, and of course the maxillary sinuses we want to see in this one. The maxillary sinuses is for the Waters view. We want to see the ethmoidal sinus rather in this one, especially the anterior ethmoidal air cells. And we want to see those above the petrous ridges. So right here, we want to see these in this picture, the Caldwell. Again, air fluid levels, so we have the patient upright, and ideally we tilt the bucci and not the patient's head, and certainly not the central ray. Our bucci didn't tilt, so we had to go with the next best thing. Anyway, also again, close collimation. Here we have a cone, which is one of the best ways to go to make sure that we don't expose anything that we don't need to expose. And here we have the Waters. This is the one where we want to see the maxillary sinuses, and there we see them. There's one and there's the other one. This one's darker or denser on the radiograph than this one, so this one may have some fluid going on in there. Again, we want to have the patient upright for this one so that we can judge air fluid levels. The petrous ridges should be lying immediately inferior to the maxillary sinuses, so they're down here somewhere. The Caldwell had them up here, the Waters puts them down here. The orbits and the maxillary sinuses in this one should be symmetrical, so that's one way that we can judge to make sure that we have no rotation. And we're looking pretty good here. The orbits and the maxillary sinuses seem to be pretty symmetrical. Air fluid levels, close collimation. Again, there's a cone on this one. That would have been ideal for our trigger. We just had to use collimation for ours because there was no cone available. So that's the PA axial. That's the Waters view right there. Next we move on to the SMV. So with the SMV, we want to make sure that we have no tilt in this one. So the chin isn't tilting toward us, but the chin is going upwards, and the IOML, of course, is parallel to the IR, and the mid-sagittal plane right here, we don't want to see that tilting on either side. It's straight up and down, and so that careful positioning required for this one. And we want to see equal distance from the lateral border of the skull to the mandibular condyles on both sides. So here we have the mandibular condyles, and then the lateral portions of the skull. This one looks like it might be slightly rotated actually, because we've got greater distance here, less distance here. That might be the patient's anatomy, and that might be a little bit of rotation. Looks like we've got the vomer right there. There might be a little bit of rotation in this one. In any case, we want to avoid rotation so that we can see the sinuses clearly. And the anterior frontal bone also should be superimposed over the mental protuberance of the mandible. So we don't want to see these kind of being wonky like that. We want to see just one solid superimposition there. The mandibular condyles should also be anterior to the petrous pyramids. So here we've got the petrous, the petrosa part of the skull, and there we have the mandibular condyles. The mandibular condyles should be in front. So we know that we've had the patient not put their chin high enough if the mandibular condyles are down there somewhere. Too close to the petrosa. Again, air fluid levels are something that we're checking for in here, so gravity would pull them back to the posterior side of the head. If we had fluid in there, we should be able to see that in this picture. So there we've got our sinuses. Next we move on to our mandible. This is our PA axial mandible. And right here, we're looking at a couple things. We want to see the mandibular body to be symmetrical on both sides. So again, no rotation, and we can look at the symmetry of the mandible to kind of judge that. We can look at the teeth. There's a number of kind of landmarks that we can look at to make sure we are not rotated here. And we want to have appropriate collimation. Again, here is a cone in this picture, which is ideal. So there we have that. The mandibular ramus and the body, so these two pictures here, the ramus and the body, we're looking for similar things. We don't want there to be any overlap between this part of the ramus, which is not the part of interest, and that part of the ramus, which is the part of interest. So the opposite side, we need to cast it high enough in the picture that it's out of the way of what we're looking at. And this is, of course, the side that's closer to the IR. So we want to avoid elongation or foreshortening of this part of the mandible, the right side in this case, and show it as close to its actual shape as possible. So here we're looking at the ramus, and here we're looking at the body. Pardon me, here we're looking at the ramus. This is the ramus here. So there's the coronoid there, there's the condyle. Ramus in this picture, body in this picture. So ramus, this area kind of, the flat portion there, and then the body here. Next we're looking at the symphysis. And again, with the symphysis we cannot overlap the part that we don't need to see, because we really want to look at this part right in here. So we need to get an appropriate tube angle to make sure that we can actually see the symphysis. No overlap of this region here, the mentum region, by the opposite side of the mandible. So we're casting this out of the image. Also, this is the part we're looking at here. So this is the part that we want to have truest to form. Everything else around it is going to be distorted, but we want to have this part be as true to the actual size and shape of the mandibular symphysis as possible. So there's our mandible. Moving on now to our ZA, zygomatic arches, we have our SMV. So this is a little bit different than the SMV for the sinuses, because we don't really care about air fluid levels in here. We're just looking at these skinny bits of bone here, the zygomatic arches. That is all that we want to see. So we're going to use less technique for this SMV, because we don't want to burn out these fine bones here. And also, we collimate a little bit differently for here. Pardon me. The zygomatic arches should be free from overlying structures, so we just want to see them very clearly. That's really all this whole picture is about. And they should also be symmetrical, more or less, given the patient's anatomy. And we don't want to foreshorten anything. Again, just like with the mandible, we want to show this as true to its actual shape and size as we possibly can. So again, we don't want the MSP to be tilted in either way. We also don't want the IOML to be too much towards us or too much away, but the IOML is is parallel with the IR. So that's our SMV. Here we have our tangential. And again, we can collimate down pretty good for this picture, because this is all we want to see right here, the zygomatic arch. We use a low technique so that we make sure that we capture this bone on our image, and we position it specifically to see this little part. Nothing else in the image really matters unless the doctor has asked to see more of what's happening around the skull and these bones, the temporal bone and the zygoma. So the zygomatic arch, free from overlying structures, no superimposition there with anything else. We want to see it all by itself. And it also should not be overexposed. So again, we use a low technique to make sure that we can see kind of the air on this side of it and air on that side of it. And then we've got that nice pretty line right there. If we are lucky, we can use the modified Townes, which is the next picture, to be able to see both zygomatic arches. And this is helpful if one of them is fractured, to compare it to the other one and see. They should be relatively symmetrical. We want to make sure that there is no overlap here with the mandible. So the mandible's coming down this way, like so, and then the zygomatic arches are out here. So again, we want no rotation, because if we rotate either this way or that way, we're going to cast the mandible, the zygomatic arch on top of the mandible, and that's not helpful. We need to see these two separate from each other. So no rotation. And they should be, the zygomatic arches should be lateral to the mandible. So that's one way also that we can check for rotation. Or that we could see perhaps if there is some kind of a fracture or something, because the zygomatic arches should be outside of the mandible, which is coming through here. Again, we use a lower technique for this one than we may for another Townes, because we're not looking at air fluid levels, we're not looking at a lot of this dense bone up here in the skull, we're just looking at the zygomatic arches. So there we have all of that.